So our job here is to get Ronald back to work so he can pay the bills, so he could feed and take care of his family and himself. It's really important, and I'm his last resort, and I take this very seriously. So we've got Ronald here. Ronald, you came into me a while ago. We needed to run some tests on you, and you're back again. And you were able to get the necessary tests for us to go ahead and begin treatment. But why don't you tell people about what brought you in here?
Okay. I've been having lower back pain for a long time, and I've been to several doctors in Connecticut and in New York, and everybody was just not telling me exactly what I had, and the pain just got worse and worse to where I was like almost bent over. I can't stand straight up. The back of my legs, it feel like it's pulling from the back pain. I took a tumble back in August of 2019, and my back started really hurting even more back at that time. That's what brought me in here today, is that I needed to get the right diagnosis and the right treatment, and Dr. Kulla, right? Am I saying it right?
Yeah.
He's been great at massaging my back and giving me the right treatments. My first treatment was on Tuesday.
So we had one treatment so far. You had your exam on Tuesday. You had a treatment.
Right.
How are you doing after your first treatment? Obviously, we're not going to try to move mountains here, but how are you doing on your first treatment?
My first treatment was great.
Okay.
After I left, I felt like I was moving more. My walking, I was able to walk longer.
Okay.
I was able to sit down and get up a little bit more better than I was before.
Okay.
I spent time with my daughter yesterday, and we went to Coney Island, so I felt great. I wasn't in no pain, not that much, but I'm back here today again.
Okay, so we're on treatment number 2 here, and I'm going to tell people about what's going on with you. So before I do that, though, why don't you tell people a little bit? I mean, it's affected your job, how you live your life. I mean, you can't even work, right? Yeah. When was the last time you worked?
After I took the fall back in August because of my back, and I couldn't go back to work. I'm a chef by trade, and I could not go back to work to stand on my feet, to bend down, to pick anything up, and to function properly. So
our job here is to get Ronald back to work so he can pay the bills, so he could feed and take care of his family and himself. It's really important, and I'm his last resort, and I take this very seriously. So I knew something was going on with his back based on the examination, so I did not treat him back in, it was a while ago, months ago. So I didn't treat you that time because I wanted you to get some tests. And sure enough, he got some tests, and we found out he has a spondylolisthesis. That's this right here. So while I adjust him, I'm going to educate all of you on what a spondylolisthesis is. Okay, my father actually has one, and it affects about 6% of the population. And what it is as you can see here, the bottom, it doesn't have to be the L5 bottom vertebra. It could be anywhere really in the spine, but typically it's most commonly found at L5. And then L4 is the second most common spot, but it's a forward slippage of the vertebra. And in some cases, like Ronald's here, there is a break, a fracture in the pars, and oftentimes it's a bony defect. Sometimes you're born with it. Sometimes it's from just too much, years of heavy lifting. For example, my father used to build rock walls around our property, and he was just headstrong on doing it himself. And trust me, I filled up many a wheelbarrows of rocks. Not great for the back, and remember as a teenager, he was laid up for months seeing patients while he was laying on his back. He couldn't move at all. So what he did was he squashed all the discs, and he caused himself a spondylolisthesis. It can also happen when you're lifting something really heavy and you're leaning back like that, and it pushes the vertebra forward and causes a fracture. Some people with spondylolisthesis do not have fractures. In this situation, he does, but we were able to check to make sure that the spondylo, the vertebra, is stable, and it is indeed stable. So we've gone ahead and started a protocol 1 of Cox Flexion distraction technique, and we're going to go ahead on a second treatment. So go ahead, lay down on your stomach, and I want you to put your chin at the bottom of the paper there. Good. So we're going to test him without the straps first, just to make sure he's fine and there's no side effects with that. You just want to make sure he's not having any pain down the side of his leg. Now, had he gone to a chiropractor and been put on his side, and they put their hand, on L5, right where he has the fracture, it could have caused a lot of problems. So it needs to be caught and addressed and treated properly and adjusted properly. So you're not going to be seeing me too often putting him on his side. If I do put him on his side, I'm not adjusting L5 vertebra. I'm adjusting something else. Okay, so just so you know that out there. Okay, so we're going to go ahead and begin here, and let me know if you have any pain shooting down the legs. You shouldn't. You didn't yesterday.
No.
Doing okay there?
Mm-hmm.
Okay, and now we're going to take one leg here. Any pain shooting down the leg?
No.
Good. And here, any pain shooting down the leg?
No.
Good. Okay. This type of treatment is not just for people suffering from spondylolisthesis, but really anybody with a disc injury or spinal stenosis. Okay, ready?
Mm-hmm.
Got you strapped in there. How are we doing there? Any problems?
No.
Good. You also, with Ronald, because he has a fracture, you really want to be very, very careful to put him on any kind of traction or spinal decompression. I would not recommend doing that at all for a case like his. And oftentimes, a patient comes in, I have back pain with pain shooting down my legs. A lot of times the doctor is thinking decompression, but in his situation, that could make it worse. How are we doing here?
I'm good.
Good. You said you were having a tightness behind your leg, right? Do you get weakness into your legs too?
Yeah.
And he has a little bit of spinal stenosis as well, and that also causes weakness into the legs. So the nerves in the lower back not only control the sensation in the legs, but they control the sensation into the lower half of the body, the feet, the toes, but also your muscles of your legs. And that's why people with spinal stenosis feel weakness or heaviness to the legs.
Yeah.
Which side's more sore?
Left side.
Left side?
Yeah.
All right, take a deep breath in. Breathe in and out. Yeah. It's gonna be really sore. These are trigger points. Take a deep breath in and out. Good. Let me know when it subsides a little bit, okay? Did? Okay. Gonna get another tender spot. It's gonna subside after a minute or so. Tender right there too. No? Okay, deep breath in and out. And again, deep breath in. Hang in there. It'll subside. Let me know when that subsides. This is all soft tissue damage.
No, that hurt.
Alright. This is all soft tissue damage. Okay? Take a deep breath in. Good. And blow out. Relax here. Is that a little bit easier now on your back? So yesterday was hard for you to even bend your knees because your back hurts so much. How are we doing today? Better. That's about as far as we can go there. Starts hurting your back? Your knees? Okay. You can see we brought him up to about 90 degrees here. When we bent his knees, he came up to about here. That was as far as we were able to go. Let's see if we can improve that. Okay. Can you go further, or is that it? Okay, a little bit further. Only about 5 degrees there. So all of this right here, feel how tight that is? Ronald?
Yeah.
We need to work through that. So I'm going to show you how to do that right now. So let's get you to stand up. So Simple lacrosse ball stretch. I'm going to give you a ball and you're going to use it to stretch the paraspinal muscle. So you're going to take this lacrosse ball and you're going to put it right there. You're going to move your feet away from the wall a little bit. Yep. Cross your arms in front of you. And I just want you to do this. Just do a shallow squat.
A shallow squat?
Yep. Come back up.
Oh, okay.
You feel that?
Yeah, it's like
it'll start massaging the paraspinal muscles. You want to keep it off the spine.
Okay.
Just on that tight muscle on the side of the spine, on both either side.
Okay.
And then I'll show you. Yep. Yeah, and the further your feet are away from the wall, the more intense, the more, the deeper the stretch. Yeah, or the deeper the massage. So here, see, I'm going to put it right there for a reason. I'm going to show you something. So I'm going to have you do this: a shallow squat, come up. Twist to the side, straighten, shallow squat, come up, twist, straighten, shallow squat, come up, all while you're rolling that ball, twist, straighten, shallow squat, come up, twist, there you go. Gets a little slippery with the shirt, but you get the idea. Yeah, and even if you just want to do it straight away like that, that's fine. And then I'm going to show you another one. If you want to go up here, which you could do up here, you just move the ball up. And you're only going to move it, you're just going to do a shallow squat. I don't want you to do a full squat, otherwise your knees are going to hurt after a while. And then also we're going to do the glute, the butt muscle. So I want you to go side to side on the butt muscle area. Any tenderness there?
Yeah.
Do that for a minute, and then you're going to turn your feet at a 45-degree angle towards me. Yep, and you're going to do the same thing. And you're just going to get more on the lateral part of the butt. Okay, I want you to spend a minute or two there. Okay. That ball is just going to help loosen the tight muscles up. Okay. And we're going to get more out of the adjustment, okay? All right, good. We'll make sure you get one of those balls before you leave, okay? All right, now lay back down on your stomach. Relax your shoulders.
Oh, shit.
You okay?
Yeah. Oh, I felt that.
All right. Take a deep breath in and blow out. Good. Okay. And another deep breath in.
Oh, shit.
Relax here and blow all the way out. You're going to be fine. Good. Okay, turn over on your back. So I just adjusted along the diaphragm. Do you ever have a hard time breathing? Yes?
Yeah.
Okay, it might be easier for you to breathe. Get a deeper breath in. Cover your nose for me with a mask. I'm going to have you cross your arms. Give yourself a big hug. All right, you're going to do this just like that. All right, big guy. Take a deep breath in. Tuck your chin. And blow all the way out. Good, and relax your head back. Okay. Now, yesterday when you came in, you couldn't even put your head back all the way, if I remember correctly.
No.
And you're doing that today. So great. Great.
Yep.
You remember that?
Yep. 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 And it doesn't feel uncomfortable neither.
Yeah, it was really painful for you to put your head back.
Right,
You
yeah.
couldn't put it all the way back. That will get better. Look, it doesn't look perfectly comfortable yet, but at least you can get the head all the way back to the,
Yeah.
you know, to the table. Relax yourself here.
Oh! God damn me.
You okay?
Yeah.
You're fine.
Oh,
Just a
God.
little startled.
I know.
So, yesterday we didn't adjust your neck there.
Yeah, we did.
No, we
I
did a
know.
different area. Now, this
Oh,
is what we did yesterday. And just relax yourself here.
Oh.
Wiggle your toes for me.
Oh!
Oh, okay.
Oh.
It's not painful, is it?
No, it's just surprising.
Surprising, yeah. Relax there. We're gonna get the Y strap. The
That's what
Y
I
strap.
said. The what?
The Y strap. Okay,
strap?
go ahead and lift your head up. Drop it back. Good. This is just a little traction to stretch your neck out. Yep. Drop your head back. Yep.
Oh, swallowing. That's
Okay. You all right?
yeah.
Gentle pull here. Doing okay there?
Yeah, that feels good actually.
Yep.
Oh. That's a bit warm.
Take a deep breath in and out.
Wait.
Uh-huh.
Wait.
You
Trying to swallow.
swallow?
Yeah.
Is it hard for you to swallow when you're lying down?
Yeah. When you got this like this.
Okay. You're all set?
Yeah.
All right. Okay, gently lift your head and drop it back. Look at that. Look at that. Now how is it bringing your head back? Feels much easier, doesn't it?
Oh yeah, it doesn't like it, before I, like further-
Just before I did this, you had your head like this,
Yeah.
sort of
That's what I said. It's further back.
tilted all the way back, like
Yeah.
bent at the neck, just to
Yeah.
bring your head to the table.
Yeah.
Now it feels a little more natural. The shoulders are touching and the back of the head. Great. You're all set. I look forward to helping you with your spondylolisthesis, and we'll see you later this week, okay?
Thank you, John.
Roll up onto your side, yep.
Oh yeah, that's roll.
And
Roll.
We're gonna need to show you how to get up off that table. Come on up.
I was taught how to do it. I just,
Let me show you again. Come
All right,
on
so
up.
you want me to
Stand up. And come around here, I'll show you. So no matter what you're doing, and I'll show everybody watching.
Yeah.
If you're on your bed, on the couch, on your stomach, on your back, turn over onto your side. Take your hand and your elbow, and at the same time as you're pushing with your hand and elbow up, you're gonna swing your legs down
Okay.
and use the momentum
Oh, the momentum.
like that.
Okay,
And
gotcha.
it's nothing to it, okay?
Gotcha.
That's the right way to get up. Thanks for tuning in.